What are the implications of your findings for patients and for clinicians?
So I think our findings are very reassuring for both patients and rheumatology providers alike. I think that our findings of rates of local and systemic reactions being overall low and mild, as well as rates of flare being low after vaccination, is very, very reassuring. And this information can help providers and patients have very informed discussions about decision making around vaccination.
And now would you like to comment on the wider context for COVID vaccination? And the first thing I have to ask you is, there have been a number of reports that COVID vaccination is less effective for the Omicron variant.
Sure. So I think we are learning, in real world data, but also there's been a number of papers showing that much higher antibody levels are required to prevent the Omicron variant infection. But reassuringly, vaccines appear to be very effective at prevention of severe infection and death. So as the SARS-CoV-2 virus evolves, I think that medical countermeasures will also have to evolve. And this will require, a multifaceted strategy, including prevention through the use of vaccination, pre-exposure prophylaxis in high-risk patients, and then early treatment and intervention with antiviral therapies to reduce severity of infection.
You mentioned there antiviral therapies, and some countries, the UK in particular, have recommended the use of sotrovimab and molnupiravir for patients who are immunosuppressed who develop COVID symptoms. Now that would cover rheumatoid patients, wouldn't it?
Yes, absolutely. And these are the patients on immunosuppression or who are immunocompromised in some way. They're the high-risk patients that we really have to work in the medical community to protect. And as I mentioned, I think that these patients are the ideal candidates for early treatment with antiviral therapies, because it has been shown to reduce severity of infection, and something that we're implementing here. Obviously, early treatment requires early detection of infection, which requires easy access to testing. But I think, as a medical community, we're going to have to continue to advance and progress our countermeasures to protect the most vulnerable in our society.
You mentioned early treatment there. Can you tell me what antivirals are being used at Johns Hopkins?
So in our high-risk patients, we're using Paxlovid when it is available. Hopefully, supplies will increase over coming weeks and months. And then molnupiravir is also an option, although we're preferentially using Paxlovid if it's available.
Thank you. And finally, what is your message for patients with rheumatoid and musculoskeletal disease who are thinking about vaccination?
So I would urge patients to get vaccinated. The risk of not being vaccinated includes getting COVID-19 infection, and the risks associated with that include severe infection, hospitalization, and death. While on the counter side, the risk of vaccination include very mild local and systemic reactions like pain in the arm and fatigue, and less than 1 in 10 chance of a flare of underlying rheumatic disease. So I think, the safety profile of the vaccines is very reassuring, and I would urge patients to get vaccinated if they can.
Dr. Caoilfhionn Connolly, thank you very much for talking to us today about this interesting study. I'm sure many people will find the results reassuring. For more information about Dr. Connolly's work, please visit our website using the link in the description, and be sure to sign up for more news, videos, and journals. For updates straight to your inbox, please sign up using the link below. And as always, thanks for watching.